This is Clinicians Corner with Dan Cahigas. And now your host, Dan Cahigas.
Good afternoon, ladies and gentlemen of our 970 listening audience. This is Clinicians Corner, and I'm here every Saturday from 3 to 4. And we have a fantastic lineup for the remainder of 2017, and today will be no different. Want to go over our basics. Show is sponsored and paid for by Clinicians Supplement Consultants. That's my company. I am the founder. I've been in this industry for 21 years, and this show is an extension of what I do every single day in my day-to-day life. What is it? Find the latest, greatest, best, newest, and most trusted supplements in the industry. Well, this is a live show, so of course we're getting calls as we speak, but if you want to give us a call anytime in the office, 855-272-7220. 855-272-7220 is the number in my office to call us anytime. If you want to check us out on the web, who are we? What do we do? Clinicians Supplement Consultants. You can go to supplementconcierge.com. That's supplementconcierge.com. Check us out, and we'll talk a little bit about some of the services that we offer. If you are in the Twitterverse, we have a very large Twitter following, but I want to add more people. Follow me at CSC Newsfeed on Twitter. It's CSC Newsfeed on Twitter. And on Facebook, it's our company name, Clinicians Supplement Consultants. And of course, we're in the concierge business of supplements, so whatever's easiest for you to reach out. If you want to call, you want to email, we can accommodate you. I am one of the only companies that I think I am the only company that operates in the professional space that works directly with doctors and gets patients the products that the doctor prescribes from multiple brand sources. So we're not a one-stop shop. We have over 10,000 products in our catalog. Whether you're looking for a physicians-only brand, whether you're looking for a specific product from a specific company, just give us the name of what you're looking for and who put you on it, and we can get that product for you right away. Some of the people who advertise right on our show, and one of those people is Clear. Clear, we have Dr. Stephen Olmos coming on in the second half of the show, but Clear will be there displaying their newest products, newest flavors, newest technology, along with many of the other companies that we already have dealt with for many, many years and sell their products directly to consumers. So it's an exciting show because not only do I get to meet with good old friends and learn what new products they have out, but we learn and find everyday new companies. Coming up, we have a wonderful new guest, Dr. Stephen Olmos, and we'll be right back.
Stop breathing right now. No, really, hold your breath. This is how it feels when you're stuffed up due to colds, flu, pollen, dander, postnasal drip, or any other reason. That's when you need Clear Saline Nasal Spray, the only spray with the power of xylitol. That simple saline solution you're using is only doing half the job. It's just rinsing. In multiple research studies, xylitol has been shown to reduce bacterial adhesion and help keep your nose moist and clean much longer than saline alone, making Clear more effective at washing away that nasty gunk in your nose. Clear is so powerful, it's been granted over 11 patents. So step up from that wimpy saline spray to something that actually works faster and better at getting you the relief you need to start breathing now. And if your doctor isn't talking to you about Clear for your congestion, maybe you need to get a new doctor. You don't just rinse your hands. Why would you just rinse your nose? Clear Saline Nasal Spray with xylitol. Available at Walmart, CVS, Whole Foods, Rite Aid, and everywhere else. Or Clear.com. That's XLEAR.com. Now go wash your nose.
It's Clinicians Corner with Dan Cahigas. Here's Dan.
Good afternoon, ladies and gentlemen of our listening audience in the 970 listening area and beyond. This is Clinicians Corner, and we are here every Saturday from 3 to 4. We have a very special guest interview today for you, and we want to go over where our guest is from and what they're going to be talking about. So first, I want to thank Clear, and many of our listeners know Clear has been a long-time sponsor. They've been with us for over 10 years, and that's XLEAR. They are the premier product for xylitol, and they have Clear Nasal Spray, which is available in Vitamin Shop, Whole Foods, Sprouts, and other fine health retailers nationwide, and now is also available at CVS, Rite Aid, Walmart Supercenters, and online you can visit Xlear, that's XLEAR.com. But today we're going to be talking about something very specific as it relates to oral health, sinus health, breathing-related sleep issues. So we have with us today Dr. Stephen Olmos, who's been in private practice for more than 30 years, with the last 20 years devoted to research and treatment of craniofacial pain, temporomandibular disorder, or TMZ, and sleep disorder breathing. He obtained his DDS from the University of Southern California School of Dentistry and is board certified in both chronic pain and sleep-related breathing disorders by the American Board of Craniofacial Pain, the American Academy of Pain Management, the American Board of Dental Sleep Medicine, and the American Board of Craniofacial Pain and Dental Sleep Medicine. Dr. Olmos is the founder of TMJ and Sleep Therapy Centers International, with over 45 licensed locations in 7 countries dedicated exclusively to the diagnosis and treatment of craniofacial pain and sleep disorders. He is currently the president of the American Academy of Craniofacial Pain, and Dr. Olmos joins us today to discuss sleep-related breathing issues. Dr. Olmos, welcome to Clinicians Corner in New York.
Thank you, Dan. Appreciate the opportunity.
Oh, we're very excited to have you here. We often spoke about the importance of oral health. I've attended the American Association of Oral and Systemic Health's meetings many times, and people don't realize that total body health really starts in the mouth, whether it's immunity problems, whether it's not getting the right sleep because of another health order, a health disorder, or just in general overall health. Even in gluten sensitivity, everything starts in the mouth. Everything starts with the air we breathe in, the way we take it in. So tell us about your experience in breathing-related sleep issues. And it's really not a new is it a new concept? Have we been aware of some of the issues?
Well, I came to treating people with sleep-breathing disorders. Originally, my focus was chronic pain. So many years ago, we have these patients come through and, they have jaw problems, they have nerve injuries, facial pain, they can't open their mouths. They have all these kinds of issues and headaches, and never really were able to have real good success over long term. Surgeries, all sorts of things are done to the jaw. People have become very myopic about the symptoms, and what we've come to find out is that the symptoms of the face and the jaw are really secondary to problems in breathing. And as you were saying, that the origin of a lot of people's problems is the mouth. Well, I would say the mouth is the place where all of these things that are wrong with the body are observed. So I often say dentistry is a lot of local treatments for systemic problems. Knowing that breathing is the primary function of survival. We can go a long time, probably 3 weeks without eating, 3 days without drinking water, but can't go 3 minutes without breathing. People understand the priority, and so the nose is a huge factor in this equation. And what we come to find out in the correlation between breathing and facial pain problems is just such a high overlap. And because of the survival mechanisms of the way the brain's laid down, that it makes breathing the highest priority. So interesting enough, the most vital thing that we do is probably the thing that's least checked by any clinician. So if you go to your physician, dentist, chiropractor, whatever healthcare provider you're seeking, the ability to breathe and how well you do it is probably the thing that is last checked. And I find that amazing. But unfortunately, that is the case because education has not been given. In dentistry, last year was the first year that it was required undergraduate, dental school education was included in sleep. So that was the first time. And so all dentists that have graduated previously have very limited education on this, and certainly physicians and all other practitioners. So this is relatively new. It's relatively new in medicine. The CPAP machine was first developed in 1981. So the whole thought process about how to treat it, and certainly in dentistry, is very new. So the thought process that breathing is important is a relatively new topic. Excuse me.
Well, Doc, there's a lot of treatments and therapies now for sleep disorders. People don't realize there are things people can do that are currently suffering to help relieve or remedy their situation. And the answer, and correct me if I'm wrong, may not always be a CPAP machine. There's a lot of other things that people can do on a regular basis. We're here in New York. I'm of Italian descent, so I happened to watch The Sopranos for many, many years. And there was a famous scene where somebody in the show was getting a CPAP machine, and it was this big clunky thing and a big giant mask on his face, and he turned to him and said, "How many MiGs you shoot down this week?" Meaning he looked like a fighter pilot. So now, I see, because of my own family, being in doctors' offices on a regular basis for my clients, and through my own family members, I see that the CPAP machine itself has completely evolved to be less obtrusive in a person's life, and there is also a much larger array of tools at a doctor's beck and call to use more than just a CPAP machine. So what are some of those therapies and treatments that people can use and do you have access to in your daily practice?
Well, yeah, a very good point, Dan. And interesting enough, I'll be lecturing at the Greater New York Dental Meeting in November on these very topics that you just brought up. The understanding that people have a multitude of problems. Essentially, there are two basic problems for most people. They either have a functional breathing problem or they have collapse of the airway. So collapse of the airway happens only in the unconscious state, so that's what people would refer to as obstructive sleep apnea. If it's physically obstructed, like the tongue or the jaw falls back and blocks the airway, then machines like the CPAP that you talked about can be useful. But the problem is utilization of those is very low. When looked at for people using them greater than 4 hours, about 80% of the people don't use them longer than that. So it's an effective tool, just one that isn't utilized well. So oral appliances. I have apnea, but I sleep with an appliance in my mouth. So does my wife. It allows us to breathe at night and able to lower our blood pressure, allow me to sleep the whole night. Awakenings during the night, like to urinate, is the result of pressure on the heart and producing a atrial naturopathic hormone that it's like a diuretic, and it causes you to produce urine to dehydrate you, essentially, because your body thinks you have too much fluid. And that's why people have to get up. So it's a big marker. And I noticed when I was treating with the oral appliance, I was able to sleep the whole night and didn't have to have those issues. That's one of the big hallmarks. GERD, gastroesophageal reflux, so fatigue, high blood pressure, cardiovascular disease. These are all the comorbid things. And so, we have all kinds of combinations of therapies. But one of the other problems that overlaps this is functional breathing, loss of functional breathing. What does that mean? That means you're supposed to breathe through your nose. Believe it or not, that's what a nose is for. It's to filter, moisten, and warm air before you bring it in your body. And when that's plugged up and it doesn't work because of maybe mechanical things, swollen tissue, you mentioned xylitol, the clear products, that is excellent for lavaging and shrinking swollen tissue so that people can breathe. And interesting enough that the two biggest reasons why oral appliance therapy is effective is dependent on how well your nose works. It's called nasal airway resistance, and BMI, your weight, body mass index. So the nose is a huge factor in the equation of treating obstructive sleep apnea. There's some studies that are coming out. Dr. Catalano from Boston University has shared with us at a symposium that I lectured at a few months back, and he was showing us that he's about to publish a paper that shows with nasal surgery that he's able to reduce people's sleep apnea problems by 50%. So that's really important stuff for us to understand, that we have to manage the nose when we're treating collapse of the airway. So those are different problems. One, a problem with the nose is 24 hours a day when it doesn't function, but the collapse of the airway is only when you're unconscious. See, people with apnea, they breathe okay when they're awake, but it's when they're unconscious is when it collapses. So we have so many more techniques nowadays to be able to address these and find the best solution for people, whether it be combination or. But we do so by evaluating the airway. We use cone beam CT imaging, so it's a three-dimensional evaluation. People are diagnosed with an obstructive apnea. Well, then we find out where the obstructions are and then come up with the best plan to specifically treat their needs. And I find that most people would prefer not to be ventilated, like you were saying about The Sopranos.
So you've explained how important it is to breathe through our nose, and when we're awake, that's great. But there are certain things that we can use on a regular basis to help, even when we're not awake, breathe through our nose and breathe clearer and cleaner. What are some of those things? Are there products? Or what do we have?
Well, yeah. See, the thing is that when you don't breathe through your nose, there's a lot of things that happen. So, first of all, there's a gas in your cheekbones called nitric oxide. So when you breathe through your nose, you draw that gas out and into your lungs. And nitric oxide is antimicrobial, so it kills viruses, bacteria, and fungus. And so every nasal breath fills your lungs with this gas that then is protective. So now it reduces the chance of respiratory problems. If you breathe through your mouth, we always tell people, mouths are for eating, noses are for breathing. And when you suck air in your mouth, you immediately bypass that whole immune system and immediately cause systemic inflammation throughout your body. And also it causes forward head posture. So when you mouth breathe, your head actually goes forward and kind of rotates. And this develops a lot of neck and low back pain. And so this is, a very common problem. I think it's the fourth most common reason for all physician visits is low back pain. And people would have no idea that these have relationships to the jaw and the face. So breathing through your nose is all important. Now, the problem is that if people use antihistamines, decongestants, or even worse, steroids, then these all have rebound. That means they work for a little while, but then what happens is they cause swelling that actually makes the problem worse. And one of the reasons why I've evolved to using the Clear product, which is osmotic saline and xylitol, is that not only does it wash the tissue and dehydrate it and open it up, but also the xylitol is antimicrobial. So a lot like the nitric oxide, it kills the bugs that then cause chronic sinusitis and problems. And there's no rebound. People can use it as often as they need to. And this is really important when people are already taking a lot of drugs. The things I worry about are the systemic steroid use and, things like Flonase and this sort of thing that are now over the counter. I don't think most people realize that when they spray that in their nose, there's quite a bit of a level of that circulating steroid throughout the body. And if that was given to children, that would actually arrest their growth plates and stunt their growth. So we do have to be really careful about introducing the body to these chemicals, and we'd like to make it as clean and harmonious as is possible.
Yeah, that's very important. People don't realize the many different drug interactions that are available that can occur even with OTC products. There's a lot of different products that shouldn't be taken with any type of high blood pressure medication. There's a lot of people that don't realize that some of those inhaled products to clear the nasal passage. I have personal experience with a family member that actually burned up their tear ducts, and for several weeks they were unable to produce tears because they used so much of that spray. They overused it. It was their own fault, but they couldn't breathe, so they kept spraying it, and they dried up their tear ducts for a temporary period of time. So it's important that when there is a natural product, something like the Clear nasal spray, to try that first, to use that wherever possible and on a regular basis. Now, you've done a lot of case studies of patients that you've treated or consulted, and how their craniofacial problems were initiated by nasal blockage or other breathing disorders related to their physiology, as well as how the treatment helped remedy those disorders. Can you talk to us a little bit about some of that?
Oh, yeah, absolutely. We're currently doing a study right now where we have quantified, how much does the Clear spray open the nasal passages, on the average person, and we're finding pretty consistently about 7% volume increase, and then that means that the flow rate increases to the fourth power. So A 7% increase in volume makes a dramatic increase in flow. And what we've come to find out is most of the people who have jaw joint locking, facial pain, these kinds of issues are directly related, and in the absence of an accident. Certainly if you got hit in the face with a blow of a baseball bat, a fist, or got in a car accident or some kind of trauma, well, that's a different story. But I'm talking about the people that didn't have those things, that developed the facial pain, jaw locking situations. We published a paper last year, 11 of our centers and the University of Tennessee, where we had almost 1,200 patients in our study that showed that there is a direct link between primary headaches like migraine, cluster, and tension-type headaches with jaw locking and daytime fatigue. And we know daytime fatigue is directly related to nasal obstruction. We treat a lot of these patients with apnea, and anybody over 5 apnea-hypotony index, this is kind of the industry standard, is needing of ventilation like CPAP or oral appliance or any of the therapies that we talked about. And we'll get some of these people that are severe. They'll be like 60 times an hour. And we'll get them down to like 5, and you would assume they'd say, "Oh my gosh, I feel so much better," and everything, but it's their nose that seems to have the biggest factor, and if you don't address the nose, and that has the biggest relationship to fatigue. So those same people that you've made better, you've treated their apnea, but they're still tired. They say, "Doc, I'm still tired. I still have the fatigue." Then we address the nose, and then bingo, all of that resolves. So the nose, you have to think, when you think of fatigue, you should think nose. Unfortunately, apnea is kind of like high blood pressure. They call it the silent killer because there aren't great symptoms with it. A lot of people are just surprised when they're told that, they could have obstructive sleep apnea. So, I can't have that. Can't tell you how many people I've had in my office with the husbands sitting next to the very thin wife going, "No, there's no way." And, I've watched the person the whole night. They don't have any of these issues. And then you do a sleep test, and they stop breathing 40 times an hour. So that's why you have to go by health histories. You've got to look at the comorbidities and, the hypertension, the, awakenings, urination, fatigue, all these kinds of things, diabetes. But in treatment, you want to make sure that in all factors, that the nose is part of that equation. So we look at 4 parts of obstruction in the papers that I've written: the nasal valve, the nasopharyngeal area, that's where the spray works to shrink the tissue. At the soft palate, we call that the velopharynx. It's the most narrow part of the airway, and at the base of the tongue called the oropharynx. So we have to make sure all of those work for a person to breathe, both day and night. And proper breathing is through your nose. Your mouth should always be closed. And I think those are some of the things that people can look for. So if they have dry mouth in the morning, if they have these kinds of facial pain, those things are all direct related. We found a direct correlation between fatigue and jaw locking. And so we know the people whose jaws lock are because they have to open their mouth and are holding it open to breathe. These are new things because previously dentists would do more and more therapy for the jaw, and of course never get anywhere because we didn't understand that the real problem was breathing.
Yeah, it's you think back to when you were a child, and you can always recall the friend in the class or the other child who had the runny nose. And Dr. Lon Jones and I have often talked about it, about kids who are mouth breathing, and they actually had a study. I wish I could pull it up. I tried while you were talking. There was actually a study that showed children who are mouth breathers don't do as well in early adolescent education, whether it was because of the lack of oxygen or something else. But, breathing, it sounds like it's such a simple thing. Breathing is really step one to health. The two key parts of every anti-aging meeting that I go to, it starts with, diet and exercise, of course, but good night's sleep, rest, is always the first or second thing that a doctor or a healthcare practitioner should instill in their patient before they ever get to any type of treatment program. So it really is important, and the work that you're doing is very important, and it's wonderful to know that there are natural products in this space now that can really help. I mean, Clear nasal products are widely available. They're at Vitamin Shop, they're at Whole Foods, they're at Sprouts. Pretty much any fine health retailer nationwide has them, and plus CVS, Rite Aid, Walmart Supercenters all have these fantastic, what I would consider to be an integrated health product, but at the end of the day, it's a nasal product, and we can do this. People can do this on a regular basis, and of course, if they can consult with someone like you, what is it, tmjtherapycenter.com, you spelled it R-E, tmjtherapycenter.com, they can absolutely find out where there is a healthcare practitioner in their area to even help themselves with a like-minded physician or a physician under your direction, correct?
Absolutely.
Okay.
Yes, and that's a great resource. Thank you for sharing that. We have offices all over North America, Australia, New Zealand, in Dubai, Bahrain, and in the UK. So we are global. My mission is to share this with the world and set a standard of care so that people can breathe normally. It's interesting. People have these problems everywhere. It has a lot to do with our diet and other kinds of things, but you said it. Everything starts with proper breathing, and that means through the nose.
Well, Dr. Olmos, I want to thank you so much for being our guest today. I know you're busy. I know you travel. With 75 centers, I don't know how you could find the time to be on our show here. But, hey, listen, you just reached out to a 50,000-watt station, several thousand people, maybe more. Is there anybody in our listening audience in the New York metro area, is there a place that they can call, or should they visit you directly at your website to find you or seek help?
Oh, I would definitely recommend they go to our website, and then there's a directory to find a practitioner closest to their area.
All right. And again, if you want more information about Clear products, it's xlear.com, xlear.com, or you can visit Vitamin Shop, Whole Foods, Sprouts, your local fine health food retailer, CVS, Rite Aid, Walmart. Again, clear.com is the resource to find where to get these products, who to buy them from. And we're speaking today with our very special guest, Dr. Stephen Olmos. Thank you so much for being with us, Doc, and we hope to have you on again soon.
Thank you, Dan. I look forward to that.
All right, thank you.